Hello, I'm Dr. Alberto Pertusa. I am a consultant psychiatrist with 20 years of experience. I'm also one of the founders of the London Psychiatry Clinic, and I've served as the research director since we established the clinic in 2020. I specialize in the diagnosis and treatment of mental health conditions. I'm an adult psychiatrist, but I can also see young people from the age of 16. I have experience treating most psychiatric problems ranging from ADHD and addictions to anxiety disorders like OCD. And a note about labels, I actually find myself in my clinical practice that some of the patients I see don't fit neatly into one standard diagnostic category. I am neurodivergent myself, and more specifically, I am on the ADHD spectrum. Now, being neurodivergent just means that your brain works differently from what's considered typical or neurotypical. My own personal experience has helped me understand some of the challenges and strengths that come with neurodivergence, and it often helps me connect with and support my patients who are neurodivergent in a way that feels relatable and validating for them. Our first consultation is an essential step in your treatment journey where we can work towards what we call a diagnostic formulation, which aims to try and understand where you are now and what's contributed to it. The idea is to come to a common ground where ideally my diagnostic formulation will make sense to you as well. And the next step is then to co-create a treatment plan together. And these options can include medication, therapy, lifestyle changes, and many other things. The toolkit that I use includes medication, talking therapy, and coaching, as well as some other interventions like lifestyle interventions. And with regard to medication, I have over 20 years experience prescribing most psychiatric medications, and I also feel comfortable prescribing some off-license medications in certain situations, if appropriate. I often get the question, what if I don't want to take medication? And well, there's absolutely no shame in not wanting to take medication. And as a general stance, it's actually a fair one. Now, thankfully, the vast majority of mental health problems can be approached from different angles beyond medication. And so the idea is to discuss the pros and cons of each available option so we can create a treatment plan that feels right to you. I'm all about discussing personal preferences and having a plan A and plan B and so on. I have experience delivering some talking therapies, particularly cognitive behavior therapy or CBT, as well as coaching, and I incorporate elements of these during my consultations. However, if someone needs ongoing therapy, I generally tend to refer them to a clinical psychologist or a psychotherapist. In my opinion, finding the right therapist for each person is a bit of an art. Now, why is that? Well, ideally, you want to take into account quite a few factors, such as if they prefer face-to-face versus video appointments, personal preferences of the patient, for example, if they prefer a female versus a male therapist, the type of therapy that the therapist is going to be delivering, which we refer to as the framework, which could be CBT, psychoanalysis, EMDR, and so on. And also other things like whether the patient is neurodivergent or if they would like to explore issues related to sexuality or gender identity. Lifestyle interventions like sleep optimization, supplements, and changes to our diet or exercise regime can make a significant difference in some cases. I practice psychiatry using an integrative approach that blends evidence-based treatments whilst adhering to established clinical guidelines, such as those from NICE, which is the National Institute for Health and Care Excellence. Although some people view conventional and integrative psychiatry as different approaches, I have found that combining conventional treatments like medication and psychotherapy, for example, with other innovative but still evidence-based interventions can improve recovery without compromising scientific or professional standards. Making key changes to the way you eat or using interventions like probiotics, for example, is gaining a lot of traction as a strategy to support mental well-being. And this is because of emerging research on the role of the gut-brain axis or the gut microbiome in certain conditions. Now, if you want to work on your nutrition in more detail or even explore things like a ketogenic diet, I'm very happy to refer you to one of the dietitians I work with. Sleep is a huge topic, not just in psychiatry, but also in longevity medicine in general, because there's a growing evidence that sleep plays a significant role in overall physical health and mental well-being. A significant proportion of the patients who see me have sleeping problems, generally onset insomnia, which is when it's hard to fall asleep. But it can also be maintenance insomnia, which is when your sleep is broken and you wake up through the night. Sleep has also been a very important topic for me from a personal standpoint. In order to fix or optimize your sleep pattern, I can use a variety of medication and non-medication strategies to improve sleep. I can also refer patients for a course of CBT for insomnia with an expert practitioner. And for those who are interested in self-quantification, I'm also experienced in wearables to track and quantify sleep, such as the Oura Ring or the Whoop Band or the Apple Watch. We know that there's a strong correlation between certain mental health problems and diet, which is mediated by factors such as the gut microbiome and inflammation. I have a very keen interest in metabolic psychiatry, which is a recent school of thought within psychiatry that explores how metabolic health factors, such as inflammation or insulin resistance, can influence mental health. Metabolic psychiatry leverages interventions like ketogenic diets or certain supplements to optimize brain function. There's a really large body of evidence showing the very positive effects that exercise has on mental health symptoms. Just to mention an example, the most recent NICE guidelines for depression recommend physical activity as an add-on to other treatments such as medication or therapy. Now, in my view, the main challenge when it comes to exercise is helping the person decide which type of exercise is going to have the highest benefit with the least amount of effort or commitment, and to be creative in terms of finding options for people who dislike exercise or who have limitations like joint pain, for example. My goal is for you to feel understood, supported, and empowered to make positive changes. So you could think of our consultation as an opportunity for personal growth and transformation. Thank you for considering me as your partner in care, and I look forward to working with you.